nanograms per milliliter. Another one, a 50% reduction. Another one, 50% at 52 nanograms per milliliter. It doesn't take much to see that each and every one of these goes down with a higher vitamin D level. Here is a meta-analysis of all of those and others as well, showing exactly the same trend. And it is very, very clear that we have an issue with breast cancer that is directly related to vitamin D. Other diseases I want to hit lightly: type 1 diabetes. Type 1 diabetes is a disease that almost shouldn't exist. Note on this chart that we see 78–80% reduction in the incidence of type 1 diabetes by only 2,000 international units a day. It is such a shame for it to exist. In Finland, it actually has increased because they decreased their dosage from 5,000 IU down to 400 IU, and their type 1 diabetes incidence quadrupled. We need to prevent that. Falling. Many of you have elderly parents. What happens when people fall? They go into nursing homes. And/or what else happens when they fall? They die. The probability that somebody's going to die in the next 5 years once they have fallen goes up by a factor of 2. And it's just because they become immobile and unable to care for themselves. The risk of falling is down by 50% in this study, and in other studies it's been as much as 80%, because vitamin D affects the muscles, not just the bones. Neuromuscular function, this chart actually goes up, but what we're measuring here are performance scores. People did better with basic functions of being able to walk and stand up, sit down, and whatever. Blood pressure. This is a quick measurable. We've been talking about diseases like type 1 diabetes or cancer. You don't get to measure those in a year. Vitamin D and blood pressure, on the other hand, you can measure that within a period of 6 weeks. And this is certainly one of the major cost burdens in our society. And this shows from a study by Ed Giovannucci and all at Harvard, a hypertension burden reduction. Note here that it affects men a little more greatly than women for some reason, which we don't yet know, but that's there. Influenza, a funny question was asked by somebody once, or sort of funny anyway. Anybody ever wonder why we get the colds in the wintertime? Well, maybe it just happens to be that we don't get enough vitamin D in the wintertime. Short disease summary, those that we know a lot about: certainly breast cancer, the type 1 diabetes, multiple sclerosis, colon cancer, heart disease, falls and fractures. We know so much about that it's just almost like rock solid stuff saying you need to deal with this. The areas where we still have a lot of missing information, certainly aggressive prostate cancer, endometrial cancer, the lymphomas, and lung cancer. There's a lot more to be done there. Again, more research. There's been some marginal things, or at least beginning studies, on brain development and cognition, where they show infants that at the age of 12 months are able to do more cognitive tasks when they have adequate vitamin D. Infectious diseases, pain. Pain is one that I have only recently learned is one of those things that's affected in a very short term, in as little as 2 months, on vitamin D. Pain is one of our society's biggest reasons for doing workman's compensation. I can't show up to work because I'm in too much pain. And the pain seems to be very much related to one's vitamin D level. Autism, there's research going on that, on depression, mental illness. All of these things can be affected. At this point, Dr. Garland is now going to talk about the whys. I've given you a quick brush of here's all the things that vitamin D can and we believe does impact.
Thanks, Carol. We're already beginning to get some useful information from this grassroots health study. The volunteers are taking their own blood samples. They're being analyzed, and what we're finding is that even in very health-aware people, about half are deficient in the amount of vitamin D they need in their blood to remain healthy and avoid cancer and other serious diseases. And at the same time, we're learning that approximately half are already at 40 to 60 nanograms per ml. This population is much more likely to be at these high levels. And these high levels will give us an opportunity to understand the safety and efficiency of higher levels of vitamin D even now than are currently recommended, in the range from 70 nanograms per ml and higher. So it's a whole new opportunity that can be done without a randomized controlled trial that may come later. But for the moment, this is an observational study that is going to be probably the most powerful tool we have for understanding the effects of self-selected higher levels of serum 25-hydroxyvitamin D. Most of these people are probably getting these high levels from spending 5 to 10 minutes a day in the sun. A few of them may be doing it by supplementation. It's very difficult to do this from diet. As you might imagine, we get a lot of questions about vitamin D and its ability to prevent disease. And one of the most common ones is, how much vitamin D should I take? And you'd think there would just be a pat answer to it, but it really depends on your serum 25 vitamin D level. And that you can determine with a test. And then the test serves as the basis for determining what the right amount is. Now, generally speaking, the amount of vitamin D in the blood is dependent on the amount of vitamin D that's consumed. So that if you consume, for example, 1,000 international units, your vitamin D in the blood will go up by 10 units. If you consume 2,000, it goes up by 20 units, or nanograms per ml. But the best thing to do is to get the test done, discuss it with your doctor, nutritionist, consult an authoritative source, and then select the amount that you're going to take based on that. It'll be a little less if you're getting out in the sun regularly. And as an example, if you decided that you wanted to raise it by 20 nanograms per ml, then you would take 2,000 international units to do it. But in some times and places, you may not need that much. In other areas, you might have to think about getting a little more sunlight, although not more than 5 to 10 minutes a day, to supplement the oral dosage. Another question that we get is, should cancer patients take vitamin D? And we didn't have an answer to this until recently, when studies were done that followed the success of treatment and the survival of patients with breast cancer and colorectal cancer. Breast cancer work was done in Toronto by Pamela Goodwin and her colleagues, and the colon cancer work was done in Boston at the Dana-Farber Cancer Center at Harvard by Kimmy Ning and her colleagues. And what we now know is that people that are around 40 to 60 nanograms per ml do twice as well in cancer treatment. They're twice as likely to survive for a decade or so after their diagnosis, half as likely to die, about half as likely to suffer a recurrence. So every cancer patient should be taking vitamin D. There's now almost no reason to not take it. There are 10 mechanisms of favorable action, including what's called a pro-apoptotic effect, which is an effect that would potentiate the effect of chemotherapy or radiation therapy. As part of normal nutritional support, every individual with cancer should have a level of 40 to 60 nanograms per ml in their blood. As with anyone under medical surveillance, people should be tested regularly for their ionized and total serum calcium, just to make sure it isn't going too high, because sometimes in malignancy it does, and we don't want to add to that. But generally speaking, if that test is done, maintaining 40 to 60 nanograms per ml will substantially improve the survival of cancer patients, more than anything else that has arisen in the past 5 decades. Another question that often comes up is, how do I get the vitamin D? And for most people, when you measure vitamin D in the blood, what you discover is that it depends on the amount of time they spend outdoors. If it's outdoors in the sunlight during the late spring, summer, and early fall, about 10 to 15 minutes a day is enough to make a substantial amount of vitamin D, although 40% of the body has to be exposed. So the person has to be wearing shorts, or shorts and a little top in a woman, and has to be out in the sun, ideally walking around or moving for 10 to 15 minutes a day. And that only works between the hours of about 11 a.m. and 1 p.m. At other times of the day, there's too little ultraviolet B in the sunlight to make vitamin D. So for eons, vitamin D has come from being outdoors. But there are other ways to achieve it. If you have a history of skin cancer, for example, or you just don't like being out in the sun, your work prevents it, then food is a possible source, and some food contains vitamin D, and there's about 100 international units in a glass of milk. But you'd need to drink 10 glasses of milk to get 1,000 units, 20 to get 2,000. So you'd be drinking quite a lot of milk in order to achieve this objective with food alone. So for many people, supplements is the answer. Vitamin D3 supplements, known as cholecalciferol, you take the amount necessary to achieve the serum level of 40 to 60 nanograms per ml. And it's a matter of checking and rechecking the serum to be sure that you get to the level that's effective in disease prevention. Now, there are a few contraindications to taking vitamin D or adverse interactions. And one of these is vitamin A. And many of the products that people buy to get their vitamin D contain substantial amounts of vitamin A. And unfortunately, vitamin A and D use the same receptor. It's known as the vitamin A and D heterodimer receptor. And if vitamin A gets on board, vitamin D has a hard time getting on board, and the effect of vitamin D is diminished. It's competition at the receptor level. So you want to keep your vitamin A intake below 6,000 international units a day. It's just not necessary to take a high amount of vitamin A. It actually is counterproductive. Cod liver oil, unfortunately, contains both vitamin A and D, so you can't really get to effective levels for cancer prevention, or it's nearly impossible with vitamin A interfering with the effect of vitamin D, which occurs in cod liver oil. So you're looking for something that contains only vitamin D3, cholecalciferol, as long as you're at the usual intake level of vitamin A. 1,000 international units a day really would meet those requirements. If you have a granulomatous disease, tuberculosis, or sarcoidosis, sometimes those diseases result in a high vitamin D level in the blood of a potent metabolite known as 125 vitamin D. And most people who have these diseases are well aware of them. And if you have them, you shouldn't change your vitamin D intake or your intake of calcium without consulting your doctor. In some cases, it may be possible to do it. In others, it would be contraindicated, meaning that we can't have you taking vitamin D if you have a very active granulomatous disease. This affects only a very tiny proportion of the population, less than 1/10%. Another question that I get often is, should I be tested for vitamin D? And well, the answer is, of course, absolutely. You need to establish what your baseline level is. You're in the dark without the test, and the test tells you how much vitamin D you're going to want to take to get just the right amount of serum 25-hydroxyvitamin D. Normally, you don't want to delay. I think everyone should test as soon as they become aware of the message that we have. But then it's probably wisest to test in March of each year, because that's the point where the vitamin D level is lowest. And most of the damage done by vitamin D deficiency is in those late winter and early spring months when the vitamin D is in very short supply. We metabolize, according to Dr. Robert Haney and his colleagues, almost 5,000 international units a day of vitamin D. So we go through it quite rapidly, and we're very depleted by March. And that's the point of the year where it's best to test, and in that way you'll determine what your low is and make sure that you address that. And this should become a lifelong thing, that you check on your vitamin D annually in March, just to be sure that because of changes in your lifestyle, how busy you are, whether you're outdoors, you don't let the vitamin D fall to a precarious level that will put you at high risk of cancer. It's completely avoidable. Thank you very much. We hope you learned something more about vitamin D that will inspire you to seek more information about it. It's a burgeoning field. There's a lot to learn. Thank you.
Thanks again to each and every one of you for coming and for listening today. We hope that you have found enough to do, not just to learn new things, but actually to take action. And of course, the final slide or the final whatever of any show is to say, what am I supposed to do? And then what you're supposed to do is to get your serum level measured. And ideally, we'd like to invite you to sign up for our D-Action study. And the website there is listed, joindaction.org. And get your serum level adjusted to the 40 to 60 nanograms per milliliter range, and spread the word. We could literally solve this problem in the United States in 1 year if each person only spread the word to